and welcome to Move Well, Live Well. We get a number of people that come in here with issues regarding their elbow. And it's we like to call it ELBOW-ITIS. So it could be pain in the inside part, the medial part of the elbow, or pain on the outside part of the elbow. Sometimes right there at the attachment of the tricep. So triceps tendinitis. It could be medial epicondylitis or lateral epicondylitis. And they're having pain and discomfort in any one of these or all of them regions due to their exercises they may be performing at work or at the gym or whatever it may be. So we kind of call it ELBOW-ITIS. Well, anyway, how do you fix that? How do you fix ELBOW-ITIS? If it's a tendon, if it's ligament, if it's just tightness in the muscles, how do you fix those? Well, there is a tool that we like to use as chiros or physiotherapists or whatever it may be. There's a great tool that we use to help facilitate relief in that ELBOW-ITIS. And what it is here, it's a VOODOO band. And it's a VOODOO floss band is what they the term used for it. So it's what you do. You get a VOODOO band like this, and they're pretty long. This one's about 6 feet, 7 feet long. Here, I'll put a link in the description on where to get one of these. And what you do, like if you have ELBOW-ITIS, what you take the band just like this, just above the crease of your elbow, right here. You see that, Dr. K? Okay. So the first one's going to be, first roll around is going to be the tough one because it's so long. So here you are like this, and you're getting this right here, just like that. And you can kind of see I'm overlapping it right there. You kind of see that? Yeah. I've overlapped it. And then I'm going to keep going, and I'm going to continue to overlap. See that? In through here. And then as you get to the crease of the elbow, you're going to use about 50 to 75% pull. You see that? I'm tightening it up more. See that here? Boom. Around the elbow itself, and I'm getting a good tension in through there. See that? 50 to 75%. And each time I go around, I'm about halfway over the previous pull. See that? And right before you finish, you're going to give a little bit of slack right here, so that way you can finish the walking out. You're going to pull that through right there. See that? Now, the reason for doing this occludes and compresses the entire elbow, even a little bit of the bicep and forearm. And what you're going to do as this is being compressed for the next 2 to 3 minutes, you're going to take your elbow through ranges of motion. Use your other hand to help you through this. And this is not going to feel comfortable. You know, this is pretty tight here on my thing. And you can kind of see over time what's going to happen to my hand. So you're going to take this through the range of motions here in the elbow. See that? So flexion and extension. See that? And you can even go like this. See that? Taking your fingers, going into extension, terminal extension of the elbow, taking it through that full range. And then external rotation, supination, see that? Of the forearm, and really getting that elbow through its full ranges as it's being compressed. And as it's being compressed, it opens up the joint in through there. It's like a distraction within the joint itself. And you kind of see, look what's happening in my hand. This is the nice blood flow in this hand. So I'm creating a temporary ischemia in this arm. See that? A temporary ischemia in this arm. And then there are a lot of studies when you do a little bit of temporary ischemia. And then once this lets go, all that rush of blood goes to those areas to help with healing. It's awesome.
What's ischemia in layman's terms?
Ischemia is a decrease. You're limiting the blood flow to the area. So, right there. Do that for 2 to 3 minutes. And again, you see that. And if it starts to numb or tingle, you may have to release before 2 to 3 minutes. If it's starting to get numb or tingle or really painful or discomforting, you may have to release before 2 to 3 minutes. So I'm going to take this off here. And this is going to be normal. You can kind of see through here. You're going to see a little bit of petechiae, some broken blood vessels, and that's kind of normal. So that's going to be okay. But man, now the blood is rushing back into my hand. You can kind of see that. And just the feeling of less restriction in this elbow. So it's almost like doing a myofascial release without having somebody do the myofascial release for you while you're using the VOODOO band. So this is a great tool. I can kind of feel the difference in both sides. That feels a lot less restricted. Now, I don't have any elbow-itis, but there are a number of folks that come in here who have elbow-itis, whether it be medial epicondylitis, lateral epicondylitis, or triceps tendinitis right there on the point of the elbow. Any of these itis elbow problems, pain, sharpness, discomfort, that type of thing, VOODOO band, awesome. So again, wrap it around 2 to 3 minutes. If it's too long, just go ahead and let that go. And man, that feels really good in opening that up, less restriction in through there. It's going to help decrease pain, give extra blood flow to that area to help healing. Anyway, if you have any questions with this video, drop it off in the comment section below. We thank you for watching. We appreciate it. If you're new here, hit subscribe. And when you hit subscribe, make sure you hit that bell notification button because that'll keep you in the loop with subsequent videos coming here in the near future. And that way you can continue to move well and live well. Also, I know you know folks who also suffer from elbow-itis. Share this with them. Sharing is caring. This is a quick, easy way to help relieve the discomfort and pain associated with elbow-itis and facilitate healing. So that way they can get back to their activities that they love to do. So share this with them. Also, give us a thumbs up, give us a like. It lets us know you care. Thank you for watching. We appreciate it. We'll see you next time. Take care. Bye-bye.